Welcome to the Quick Medical Review. I'm your host, and today we're going to cover a key autoimmune disease, Systemic Lupus Erythematosus, or SLE. In this episode, we'll take a question and answer style approach, walking through the most important facts, clinical features, investigations, and treatments you need to know, perfect for revision, exam prep, or clinical refreshers. What is systemic lupus erythematosus? SLE is a chronic autoimmune disease that affects multiple organ systems. It's characterized by the production of autoantibodies and widespread inflammation. What type of hypersensitivity reaction is involved in SLE? SLE is a type 3 hypersensitivity reaction which is immune complex mediated. These complexes deposit in tissues and trigger inflammation. Who is most commonly affected by SLE? It primarily affects women of childbearing age, especially those of African, Asian, or Hispanic descent. Which autoantibodies are associated with SLE? Common autoantibodies include anti-nuclear antibody, anti-double-stranded DNA, anti-Smith, and antiphospholipid antibodies. Which antibody is most specific for SLE? That would be the anti-Smith antibody, which is highly specific, though not very sensitive. Which antibody is most closely associated with disease activity? Anti-double-stranded DNA levels tend to rise during disease flares, particularly in lupus nephritis. What are the most common initial symptoms of SLE? Fatigue is extremely common, often accompanied by joint pain, fever, and skin rashes. What is the classic skin manifestation of SLE? The malar rash or butterfly rash, which spans the cheeks and spares the nasolabial folds. Are there other common skin findings in SLE? Yes, these include discoid rash, photosensitivity, oral ulcers, and alopecia. How does SLE affect the kidneys? It can cause lupus nephritis, a serious complication that requires careful monitoring and treatment. How is lupus nephritis classified? The WHO classifies it into 6 classes, with class 4, diffuse proliferative, being the most severe and clinically significant. What hematologic abnormalities occur in SLE? Patients may have anemia, leukopenia, and thrombocytopenia, usually due to autoimmune destruction or bone marrow suppression. Are there neurological manifestations of SLE? Yes, these can include seizures, psychosis, headaches, and cognitive dysfunction. How is SLE diagnosed? Using the 2023 American College of Rheumatology and European Alliance of Associations for Rheumatology criteria. A positive anti-nuclear antibody is required, followed by accumulating at least 10 points from various clinical and immunologic features. What's the first-line treatment for mild SLE? Hydroxychloroquine is the cornerstone, often combined with NSAIDs for symptomatic relief. How is moderate to severe SLE treated? With corticosteroids and immunosuppressants like azathioprine, mycophenolate, or cyclophosphamide. What's the treatment for lupus nephritis? Typically involves high-dose corticosteroids plus immunosuppressive agents such as mycophenolate mofetil or cyclophosphamide. What is belimumab and when is it used? Belimumab is a biologic that inhibits B-cell activating factor. It's used in moderate to severe or refractory SLE. What can trigger SLE flares? Common triggers include sunlight, infections, stress, and certain drugs, especially sulfa-containing medications. What is drug-induced lupus and how does it differ from SLE? It's a lupus-like condition triggered by drugs like hydralazine or procainamide. It typically resolves when the drug is stopped and is strongly associated with antihistone antibodies. And that wraps up our focused review of systemic lupus erythematosus. These rapid-fire questions are a great way to reinforce key concepts and prep for exams or clinical practice. If you found this episode helpful, be sure to follow and share it with your fellow med students or colleagues. Until next time, take care.